The part of the oral cavity, we are going to include Galayu here. Then comes the abscesses which are related to the oral cavity. That will come to Galavigrahi. Now when we think of Galavigrahi, we are not only going to think of quinsy, but we are going to think of tricopharyngeal, parapharyngeal and peritonsillar abscess. So Vigrahi means an abscess formation where we are going to take all 2-3 patients together, and when we see the patient, according to the condition of the patient, we can give the management as what has been explained in our blood test. The 3 other parts which come into the oral cavity is Balasa, Vidari and Galagraha. Again we will see how we are going to correlate. Then comes the posterior pharyngeal wall. Posterior pharyngeal wall condition is, we can explain it as Vrunda because it explains acute pharyngitis. Again we will see the conditions in detail. The most important part where we always have controversy is the vestibule of the oral cavity, and Safaja Galarbuda. We are going to compare it that with oral submucous fibrosis or leukoplakia of the cheeks or leukoplakia of the mucosa which is there at the vestibular region. Then comes the laryngopharynx. Laryngopharynx has explained 2 types of conditions, Shatagni and Mamsatana. Then we come to the larynx. Larynx has given these 5 conditions. Swaragna, Swaraveda, Mukatva, Mimilitva and Gabdavatva have been explained in one line. Then comes the thyroid region, that is the neck region, which is explained in our granthas as the Galaganda. Then comes the esophagus, that is Valaya and Galaga. And then come the next organs, that is Gandhamala. Now Gandhamala initially used to be directly correlated only with tubercular lymphadenopathy, which is not the right thing. So any lymphadenopathy in the neck region, you can take it as Gandhamala, right? Now presentation and the complaints and the samprapti, there you have to have a different thinking of which dosha has been vitiated, which dhatu has been vitiated, and the site of that particular place, and then we have to think of the line of treatment.
And Gandhamala is the last one.
Cervical lymphadenopathy or the next one. हाँ?
ये कंसेप्ट एकदम चेंज हो जाएगा, जैसे आप ओरल कैविटी को जो लेते हैं वो हम सतत रूप लेते हैं और कंठ श्लोक में आता है कंठ में प्रयोग यही करना है। आप कंठ ओरल कैविटी करता है
When we see the further slides, we'll have a better understanding. Definitely we'll have a better understanding. So these are all conditions which we are going to see. Now, another classification when we think of all the Gala Kantha Rogas, there is again a classification of 3 types.
जो आगे सर मसाले कितने बजे तक है आपका